help the patient in developing a good appetite, so the patient has a complete meal and utilizes all the nutrients from the meal provided. In order to make sure that you serve the patient effectively, you must follow some of the following guidelines. Ask the nurse about the food that is being given. Help the patient to the washroom and in washing the hands before dining. Check the environment. The temperature of the food that is being served should be comfortable. Hot food is difficult to consume and cold food is devoid of taste. Keep noise levels low. Do not shout or raise your voice. Do not bang plates or cups. If patients eat in a peaceful atmosphere, they can digest the food better. Arrange the food to be consumed by the patient in a manner where all the items are kept open for the patient to choose from. Always tell the patient what is being served and encourage the patient to eat the items that are being served. Tell the patient about the benefits of the food items being served. Encourage the use of dentures if the patient uses a denture. This will help the patient in chewing better and therefore in better digestion of the food consumed. Assisting the patient while eating. Before you plan to feed the patient, try and understand the mood of the patient. When you feed a patient, it is important for them to have a peaceful mind. If a patient is agitated and does not want to eat any food, talk to the patient softly. Do not force the patient into eating anything. Tell them the advantages of eating and how important it is for them to eat well to recover fast. Ensure that a patient is calm and comfortable before you start feeding. Check the meal tray against the patient identification band to make sure the patient gets the correct meal. The meal tray should be served to the patient at a comfortable distance. Cut the food like vegetables or meat into small bite-sized portions if necessary. Check the food temperatures. Cold foods should be cold and hot foods should be warm but not too hot to cause a burn. Cover the patient's clothes with a clothing protector such as a bib. If milk or juice glasses are covered, they should be opened and served to the patient. Feed the patients slowly. Tell them what they are eating. Talk with them and give them time between bites so they can enjoy their food. Help the person with their meal as much as needed. Call for help if the patient chokes on food or fluid and is not able to cough. Keep the patient in a sitting position for at least 30 minutes after the meal so that they do not choke. Precautions while feeding a patient. Pay attention to the patient. Do not talk to anyone else while feeding the patient. Start a conversation that will interest the patient. Say positive things about the food, such as, "This smells really good and fresh." Never treat the patient like a child. Be supportive and encouraging while serving and feeding the meal. Before serving food, test the temperature, but do not Touch the food with your hand. Feel the heat of the utensil instead. Ask the patient what he wants to eat first. Allow him to make a choice. Do not mix the food unless the patient prefers it. Do not rush the meal. Allow time for the patient to chew and swallow. Alternate cold and hot foods. Blend them as preferred by the patient. If the patient wants something different from what is being served, honor the request and try to serve an alternate food.